we are looking at the important adverse effects of the anti-glaucoma drugs. So in case of the anti-glaucoma drugs, what are the adverse effects? So to start off with questions, what is the adverse effect of the sympathomimetics? Next is, what are the adverse effects of the miotics? And what is the next question, what is the adverse effect of the carbonic anhydrase inhibitors? So to start with the anti-glaucoma drugs, so firstly we look at the beta blockers. So in case of the beta blockers, the adverse effect, it includes the corneal hypothesia. Next, it can also lead to the systemic side effects. Then we look at the sympathomimetics. So in case of the sympathomimetics, it can lead to the lid retraction, as well as it can lead to the CNS depression, and as well as apnea in infants and children. So this is less than 2 years. Next we see is the prostaglandin. So we look at the prostaglandin analogs. So in case of prostaglandin analogs, it can lead to the eyelash hypertrichosis. Then it can also lead to the macular edema. Then it can lead to the iris pigmentation, as well as the heterochromia iridis. Next, it can lead to the periorbital fat depletion as well. Next, we look at the miotics. So in case of miotics, it can lead to the retinal detachment as well as the cataract. Next, we move on to the CAI, that is a carbonic anhydrase inhibitors. So in case of CAI, it can lead to the systemic side effects as well as the corneal edema. So now to answer our questions which we initially asked. So the question was, in case of sympathomimetics, what are the adverse effects? So in case of sympathomimetics adverse effects, it includes the lid retraction, the retraction of the lid, as well as there is CNS depression and apnea. So the CNS depression and the apnea occurs in the infants as well as the children. So this is nothing but less than 2 years. Next, we look at the miotics. So the miotics, it deals with the retinal detachment. So miotics can lead to retinal detachment as well as the cataract. Next question was, what are the side effects of the carbonic anhydrase inhibitors? The CAI, the side effects being, there can be systemic side effects, as well as there can be presence of the corneal edema.
Hello everyone, this is Dr. Hub. Now let me tell you our story. Running with us, we are sure you will reach your destination with ease.